Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Avian influenza or bird flu. Introduction. Avian influenza is an infection caused by avian influenza viruses. Avian means bird and flu is an abbreviation of influenza. Avian flu can, in rare cases, be transmitted to humans. There is a real worry that avian flu has the potential to spread throughout the globe like wildfire, resulting in thousands, if not potentially millions, of deaths. This program explains what the avian flu is, its symptoms, and treatment options. It also discusses its potential future threat and how to prevent it. Viruses. Viruses are very small living particles that are made of an outer shell that protects genetic material packaged inside. In order for a virus to replicate itself, it needs to enter another living cell by attaching itself to the living cell's surface. To do so, it uses complex and unique chemical compounds found on that cell's surface. Because of the complexity of these chemicals, viruses tend to infect only specific cells in a specific species. For example, certain viruses may only attack human nerve cells, and others can attack only bird intestinal cells. Once inside the cell, the genetic material of the virus blends with the genetic material of the infected cell to replicate itself hundreds, if not thousands, of times. The hundreds of replicated viruses then kill the cell, burst out of it, and infect hundreds, if not thousands, of new cells. The cycle repeats itself until the patient dies or the patient's immune system destroys or keeps in check the invading viruses. The immune system is responsible for defending the body from foreign objects. During virus replication, the genetic material of the virus can undergo changes known as mutations. The virus can also exchange genetic material with the infected cell. These genetic changes can modify the chemicals on the surface of the virus. This, in turn, may make it possible for the virus to attack living cells of different species. There are three types of influenza viruses: A, B, or C. Types B and C are usually only found in humans and cause milder symptoms than type A, which can be found in both humans and animals such as birds, pigs, horses, whales, and seals. Avian flu viruses. The avian influenza viruses occur naturally among birds. Wild birds worldwide may carry the viruses in their intestines but usually do not get sick from them. Avian influenza is very contagious among birds. It can make some domesticated birds such as chickens, ducks, and turkeys very sick and kill them. Infected birds shed influenza virus in their saliva, nasal secretions, and feces. Susceptible birds become infected when they have contact with contaminated secretions or excretions from infected birds, or with surfaces that are contaminated with them. Domesticated birds may become infected with avian influenza virus through direct contact with infected waterfowl or other infected poultry, or through contact with objects or food that have been contaminated with the virus. Infection with avian influenza viruses in domestic poultry can cause a mild disease or a severe one that can kill 90 to 100% of the flock within 2 days. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Human infection. Avian influenza virus usually refers to influenza viruses found chiefly in birds, but infections with these viruses can occur in humans. The risk from avian influenza is generally low to most people because the viruses do not usually infect humans. Most cases of avian influenza infection in humans have resulted from contact with infected poultry, such as domesticated chickens, ducks, and turkeys, or surfaces contaminated with secretions from infected birds. About 50% of infected people died from the infection. Since 1997, there have been confirmed cases of human infection from several subtypes of avian influenza infection. There are more than 100 subtypes of avian flu viruses. A very small number of these are known to infect humans. The spread of avian influenza viruses from one ill person to another has been reported very rarely. Influenza A viruses are constantly changing, and they might adapt over time to infect and spread among humans. Symptoms. The time between infection of a person with the flu virus and the appearance of symptoms, the incubation period, can range from 1 to 5 days. The symptoms of avian influenza vary in severity depending on which virus caused the infection. Symptoms of avian influenza in humans are similar to typical human influenza-like symptoms: fever, cough, sore throat, muscle aches, eye infections. Pneumonia or severe lung infections and other severe respiratory diseases can occur. This could lead to life-threatening complications that may necessitate hospitalization and use of a respirator. If complications are not treated early, death is possible. Treatment. Prescription medicines approved for human influenza viruses should work in treating avian influenza infection in humans. However, there are no known medications that treat an avian influenza infection specifically. However, influenza viruses may become resistant to these drugs, so these medications may not always work. Additional studies are needed to demonstrate the effectiveness of these medicines on bird flu viruses. Flu treatments that should work for avian flu include rest, medications to bring down high fevers, and drinking plenty of water. If complications occur and the patient becomes very sick, then hospitalization may be necessary with administration of oxygen or the use of a respirator. Prevalence. To date, few human cases have been reported by the World Health Organization. Most cases have occurred as a result of people having direct or close contact with infected poultry or contaminated surfaces. However, a few cases of human-to-human spread have occurred. Future risk. So far, the spread of avian flu from birds to humans and from person to person has been rare. Nonetheless, because all influenza viruses have the ability to change, scientists are concerned that the bird flu virus could one day be able to infect humans and spread easily from one person to another. Because these viruses do not commonly infect humans, there is little or no immune protection against them in the human population. If the viruses were to gain the capacity to spread easily from person to person, an influenza pandemic could begin. A pandemic is a worldwide outbreak of disease. Travelers to countries with avian influenza outbreaks should observe the following. Avoid visiting poultry farms, bird markets, and other places where live poultry are raised, kept, or sold. Avoid preparing or eating raw or undercooked poultry products. Practice hygiene and cleanliness. Visit a doctor if you become sick during or after travel. Prevention tips. The following tips will help you prevent flu infections such as the common flu and avian flu. Wash your hands frequently with soap and water, particularly before eating and after sneezing or coughing. Use NIOSH-approved disposable masks rated N95 or higher and that fit tightly over your nose and mouth. Cover your mouth and nose with tissue when you cough or sneeze. Put used tissues in a wastebasket. If you don't have a tissue, cough or sneeze into your upper sleeve. Stay at home if you're sick, and stay away from others if they're sick. Eat only cooked meat and poultry.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Avian influenza, or bird flu, is an infection caused by avian influenza viruses. The virus is carried by wild birds and can devastate domestic birds if they get exposed to the virus. The symptoms of avian influenza vary in severity depending on which virus caused the infection. Symptoms of avian influenza in humans are similar to typical human influenza-like symptoms: fever, cough, sore throat, muscle aches, eye infections. So far, the spread of avian flu from birds to humans and from person to person has been rare. Nonetheless, because all influenza viruses have the ability to change, scientists are concerned that the bird flu virus could one day be able to infect humans and spread easily from one person to another. No one can predict when a bird flu pandemic might occur. Experts are preparing for the possibility that the viruses may begin to spread more easily and widely from person to person. For more information about avian flu, check the website pandemicflu.gov. Thank you for using Explain.